Ovarian Cancer Awareness Month, and believe it or not, a majority of women with advanced ovarian cancer will face a recurrence of the deadly disease. Now, the threat of this often causes additional worry and anxiety in an already burdensome situation. And joining us now to explain more about the latest in the cancer research and treatments is Dr. Robert Holloway and Anne, who will share her personal experience with the disease. Thank you both so much for joining us.
Thanks for having us.
Thank you, Chris.
So, Anne, like I said, we'll get to your story in just a little bit, but Doctor, tell us more about the latest in ovarian cancer diagnosis and treatment.
I think the latest news, which is exciting, is that there are more women alive in the United States with ovarian cancer than at any point in history, and it's because of advances in treatment and more options for treatment. What really hasn't changed, sadly, is that the majority of patients with ovarian cancer present with an advanced stage 3, stage 4 disease. They get surgery and chemotherapy, and 85% of those patients are at risk to have a relapse or recurrence of their disease once they're in remission. The news that we want to share during Ovarian Cancer Awareness Month is that there are new FDA-approved treatment options called maintenance therapy once you've had your second-line treatment, and that's significantly extending the period of remission for many patients with ovarian cancer.
Right, and Anne, I'm thankful that you're willing to share your story with us today. Give us an idea of what the journey was like after your diagnosis, and is the story that the doctor's giving, does that reflect how your situation went?
Yes, well, first of all, this is my experience, and other women may have different ones. What happened with me was that I had some symptoms that were different for me. I was having bloating and just general malaise. My abdomen was distended. I went and got it checked out, and everything, you know, I was told my ovaries were fine. But then 6 weeks later, I had to go to the emergency room because I was experiencing excruciating lower back pain. After that, I was told that I had my abdomen was flooded with cancer, and then I had to have emergency surgery. After the surgery, I was told that I had stage 3C ovarian cancer, which meant that the cancer had spread beyond my ovaries into other body parts. As Dr. Holloway mentioned, after I finished that chemo, about 6 months later, I had a recurrence, which was actually much harder than the first time. That one hit me like a hammer, and then went through another 9 months of chemo, and basically had been told that I'd be on chemo the rest of my life. Fortunate for me, when I finished that 9-month treatment, I was given great news that I was a candidate that would do very well, or could do very well, on a maintenance therapy, which I started in May. And that's why we're partnered here with Tesaro today to talk about this option and share this great news with other families and other women.
Well, words aren't enough to describe how strong you are, and how sorry I am to hear that you had to go through that. But the good news is that you're healthy now, and this maintenance treatment is really going to keep you healthy and going forward. Doctor, in the last about 30 seconds we have left, what other advice would you give women, their families that may be going through this?
I think the advice is that if you know a patient with ovarian cancer, to stay abreast of the research and new developments, that we do have new FDA-approved maintenance therapies. The one Anne is on is called Zejula. It's a once-a-day oral therapy. And patients can get more information about maintenance therapy and the potential risks and benefits of oral maintenance therapy at zejula.com, zejula.com. So the research is advancing the treatment very quickly. Have an ongoing conversation with your oncologist about new treatment options.
Well, it's important to get this conversation started to raise awareness like we're doing with this. Doctor, thanks so much for the information, and Anne, of course, for sharing your story with us.
Thank you so much.
We're very grateful to you for sharing this.
Our pleasure. Stay where you are. We'll be right back.